We talked of cardiovascular disease, so you're already familiar with this. There's a figure in your workbook that looks a bit like mine here on the slide. You don't need to remember all these different arteries and blood vessels and so on, but I want you to first of all recognize that the swelling of the penis and the swelling of the vagina are primarily dependent on blood reaching those destinations. Blood congesting, so it's called vasocongestion. That word I've spelled out there in your workbook. Vasocongestion simply means congestion of blood in the genital area, and that's what's important for sexual arousal to take place. You got no blood there, you don't get sexually aroused. So, doesn't it make sense then that if any of your blood vessels supplying that region of the body, right? Not the blood vessels to your arms, not the blood vessels to your feet, but the blood vessels critical to vasocongestion, if any of those are blocked, then you're going to have difficulty getting aroused. And I want you to know at least two of these vessels. I'm going to keep it simple. One's called the abdominal aorta. In my figure, it's about here. Do you all see that in your workbook? So go ahead and highlight abdominal aorta. It's a huge blood vessel in your abdomen, stomach area. You all see that? Abdominal aorta, highlight that or underline it. Because if that blood vessel has thrombosis or a blockage, it's going to interfere with sexual arousal. And which is why, I'll tell you, many people with coronary heart disease also suffer from impotence, also suffer from difficulties with sexual arousal. This is a question I posed to you all early in the semester. Why do people with coronary heart disease also have to worry about impotence? Well, it's because of that. Because it's not only the coronary arteries around the heart that are blocked. Many of these individuals, they have systemic blockages running right through the body. And another area of blockage is the abdominal aorta. And it surprises them. They say, wow, I thought the two are disconnected. No, they're not. Another blood vessel, not sure if it's spelled out in your workbook. I think my assistant added it in just a few months ago. It's called a pudendal artery. Do you all see that anywhere? Pudendal or pudental? Ah, okay. So it's the box pointing to that groin area. So you can fit into that box the word pudendal. Pudendal. So now this blood vessel is even closer to the genitalia, and therefore, if that's blocked, well, it's going to be critical.